Okay, here we are today. This is Katie, right? And how old are you?
44.
44. And tell me what's bothering you.
The saggy skin under my chin.
Okay, go ahead and turn to the side. That's saggy skin.
This saggy skin.
Now, bend your head down.
And all the skin.
All the skin, all that stuff.
Skin.
Okay, now go and swallow for me. Yeah, right there. Yeah, just relax the floor and mouth. You got a little bit of laxity of the floor and mouth there. Okay, cool. This way. So we will tighten that floor and mouth. Okay, this way. And a little bit. Look down here. So it's a saggy skin, a little bit in the jowls. I'm gonna come back forward. So it's gonna be pretty straightforward with you, I think. You know, you have some hollowness in the temple area as well, and then lower eyelid cheek junction area, a little bit of the nasal full, and the lips. We're gonna put a little tiny bit of fat there, right? So we're gonna do a neck lift, okay, and then we're gonna do a fat transfer. So there you go, look like you're 16 again. Okay, so I'm just gonna mark some of the places I'm gonna do a little fat transfer. Certainly you need it in the temple area because that's really the part that is really indented in here. Okay, so that, so you lost all the volume right here. So this is where a lot of the fat's gonna concentrate, is right in this area. Okay, and then look up, and then your orbit. Okay, have a little bit of hollowness under the orbit, but we're gonna fill that up a little bit. Smile. Okay, so when we fill it up, we want to make sure that when you smile, it's not too cheeky, right? So it's not really about filling up the cheeks. A lot of people, they fill up the cheeks and then they look good when they're not smiling. When they smile, it's too much, right? So when you smile, so it's really important for us to kind of know where to fill to make sure we don't overfill. Okay, so you see there's a little bit. So it really is the lower eyelid cheek junction. That's that's where we're moving the fat. So it's really, we're not putting a lot of fat like in the cheek to make it bigger, but we want to shape the face a little bit. You have beautiful eyes. We're gonna build the beauty around the eyes. Okay, and then really the biggest thing about you is this neck thing, right? This neckline right here. So, and the way that we're going to do this is we're going to do a little neck lift. But when we mark the ear, we have to be very strategic because we want to hide this incision. So this incision has to come up high. So we have to find a place to sneak across so that it doesn't show. And that's going to be for you like right here. Like right here. I'm gonna sneak across right there. So we're gonna come, so this line's gonna come like here. And then it's going to go, then we're gonna go off in the hairline like this. So once you go on a hairline, you won't see anything. Similarly on this side, we're gonna go find the area that we're gonna sneak across. It's gonna be right now here, and then it's going to go like that, and then we're gonna sneak across, and then be off in the hairline. Hopefully that's all you really need, and the incision is gonna be back here. And then the earlobe. Hopefully we don't even have to come to the front. So this. Okay, show me your teeth. Midline here. So something that we have to take note. I usually put fat in the chin, but you don't need any because you have a pretty strong chin already, especially when you smile. So we're going to be careful not to add any there. Look up for a second. So this is the midline, and then we may put a little incision here. You notice a lot of people put it back here, which causes a little indentation, and it's also very noticeable. We come right here, and that skin heals a lot better, and you won't see it. It will not indent it like if you put it here. And then the fat's gonna go rest around the lips and so forth and so forth. So this is a neck lift primarily, but we're gonna give it a little vertical vector. So we need a little tiny incision right here to give a vertical. So take out some skin vertically up here, so we don't have to make an incision in front. So that is very important to do. A little tiny incision for the vertical. That's it. So we're all set. Okay?
Okay.
Great. Okay, so we're all marked up here. Incision, it's all marked. Next to the neck. So the fat transfer is going to happen. Because of the corset, we really tightened the neckline here, and I'm really surprised how much skin we have here. Actually, she doesn't look like she has a lot of skin, but look, it's gonna be a good 1.5 inches on each side. So yeah, so it's good. Okay, we're all done. It's looking up.
Yeah, I'm gonna get you water now, okay? Let's relax.
Lips are a little swollen. Hi there. So we're 3 months out, right, from a neck lift. Yeah, and then some fat transfer around the temple area. And what do you think?
I'm very happy.
Yeah, because
I feel confident and I feel like I look like I'm supposed to look.
yeah. Let's see. Turn this way. Turn your feet a little bit. Good. All incision healing. Pretty good. Still a little bit red. Some area. Let me show me the ear back here. The ear looks nice. On the other side. Back. You look like you're 20 years old.
Okay. I'll take it.
Well, tell me about your bachelorette party.
So I went to a bachelorette party this past weekend, and half of us were in our 40s and half of us were in our 20s. And I was meeting the 20-year-olds for the first time, and we hung out for a few days. And we were at dinner, and my age came up, and one of the 20-year-olds was like, "No way, you're 44!" And I was just like, and she was just, and then she kept staring, and it was just like, that's cool.
No, it looks good. It looks really natural. Look,
Very natural.
I'm happy. Okay.